I think this is the first time in this community we've had over 200 clinicians and other health and social care professionals all together to discuss the future.
This is primary care, secondary care, community care, social care, the voluntary sector, and we have some members of our HEN network too, who are the patients and the public as well. So it's just great to have so many of you who've prioritised this time to be here today. And I think for me, if we have one output from today, it would be that we could describe ourselves as a whole, as one community.
In other areas of the country, people are able to work together in an easy way because they're close to each other. That's more of a challenge for us, and we need to develop our own ways of dealing with that. And the opportunities to get together in this sort of way are few and far between, so it's really good to get everyone together.
It's mainly about engaging people and getting them to talk together about what's possible. So I have a strong belief that new technologies are a definite way forward to integrate services.
Healthcare is almost the last industry where the digital revolution hasn't transformed the way we deliver our service.
Up till now, I don't think technology's been a strength, probably because of our rurality and reception issues, but that's got considerably better over the last couple of years, and I think there's a real opportunity for us to think about when we can use that. And again, we make an assumption that older people don't use technology, but the evidence would suggest that actually they do.
We're all signed up to the idea that care should be delivered closer to home if it can be done safely, and that the transition of patient between primary care, secondary care, back to the community and social care, if required, it needs to be as seamless as possible.
That what people want is one person looked after by people acting as one team, from organisations behaving as one system.
I think the main challenges for health and social care are also the opportunities for health and social care. There's lots of very good things happening in the Hambleton, Richmondshire and Whitby area, as well as the things that are perhaps more difficult. So this is one of the most remote and rural areas of England. We have, obviously, as with most areas, an ageing population. That's both a strength and a challenge, because actually we know that older people tend to be, as they get older, particularly over 85, tend to be bigger users of health and social care services. But they're also the people who keep our communities together. They're the glue of our communities. So actually, if you look at who are the volunteers, who are the people here today who are helping to shape what we do in the future around health and social care, most of those are older people.
I think everybody's articulated the challenge that's ahead, and it does feel like it's going to be a very challenging time for us across the care sector, and it feels like there's been some brilliant discussions and some opportunities today to look at how together we might tackle that and still give people in the communities we work with the best possible health and care outcomes.
The best and most successful organisations in any industry are open to ideas and look outside yourselves. I, from the conversations I've had today, really believe that you are that group of people.
There was a big Patients Congress this morning. There's been lots of work going on in terms of consultation to try and really understand what local people want from the local NHS and our partner agencies. And I think we need to increasingly make sure they are working with us to look at what we're proposing, to understand it, to help us shape it, and then to evaluate it for us.
I think the important thing that came out of today was, and the reason I came, to be honest, was the sense that this area was recognising that in order to meet the challenges that we have, then it has to behave as a system with the different organisations cooperating and working together.
The need to develop the teams across the whole board, making sure that ambulance were involved, mental health were involved, social care was there, all the district nursing teams as well as the general practice and all the hospital services, working as one team in the out-of-hours service, so we're all coordinated and not disparate. There is a crisis coming if we don't plan for it. We are an ageing population and we need to deal with that differently from the way we've been doing it.
The next thing has to be to distill the thoughts that came out of here into some definitive actions. This area has every chance of being somewhere that others will point to and say, go see what they did.